if somebody's listening to us right now and they're thinking, okay, I can't feel my left ventricle changing, but I do feel fatigue. I don't have the endurance that I used to have. I do tire more easily. And I've just wondered if I'm out of shape or whatever. Maybe they are. But what should they go get done? What should they ask their doctor to check? What kind of tests should they ask for cardio-wise?
And you want to understand what your risk factors are. And those are things like age. As we get older, we're at greater risk. For men, it's typically in their 50s. Women, it's in their 60s. Certainly, if you smoke, that's a big risk factor. Being overweight, as we point out about physical inactivity. And then, your diet. But when you go to the doctor, you really should talk about what your symptoms are. And sometimes people want to please the doctor, so they may not always say what's going on. But if you're over 40, you want to be getting a cholesterol level, a whole lipid panel checked. Your cholesterol, your HDL, your LDL, and your triglycerides. And you want to be doing that every year. You want to be thinking about if you're starting to have that fatigue or you're starting to have some chest discomfort, you may need something like an exercise stress test. We talk a lot about coronary calcium scores. That's in the book. And that's really a test that really is going to correlate the amount of calcium that we see on this scan with the amount of plaque that you might have. So instead of subjecting you to an angiogram where we inject dye, we can actually do a special CT scan to look at the amount of calcium. And patients need to be informed about these tests and these procedures that can be done to really analyze what's happening with your heart. You might also need an echocardiogram, which is an ultrasound of the heart.
And that'll tell you what? If you get an ultrasound of the heart, that's going to tell you what?
That's going to tell me how big your left ventricle is,
right,
and how well it functions, how well it pumps. That's one of the best tests that we have, especially as we're thinking about heart failure. And I get it, Phil, sometimes insurance may not cover it. There can be copays that can be challenging at times. But again, this is something that doesn't happen just all of a sudden. It happens over years. And to catch it sooner rather than later, that's going to pay off in the long term.
There's one measure they're going to give you is an ejection fraction, right?
That's exactly right. So that goes to your point where how well the heart pumps out blood and it's oxygenated blood. So if you're in your 20s and 30% in terms of ejection fraction, imagine it's, a bowl or a bottle and you're pumping out the water. If you're only pumping out 20 to 30% of that, that's bad because you're not getting enough blood supply and it's also backing up. So it's just staying there and that's going to go in your lungs, in your extremities, and that's going to create a lot of challenges. And it's a simple test that can be done in 15, 20 minutes.
Yeah. I've had one done recently and I could see it on the screen.
Yeah.
And you see your heart closing, making like a fist. And there's a certain angle where it almost just disappears. It just goes flat. It's closing so much. And you get an ejection fraction, I think, above 50 is normal. 65 is great.
Even better.
And, yeah. I don't know whether it was covered or whatever, but I sure felt better when I saw it and saw the numbers and stuff. And they said, no, you're good to go. And they did the same thing on the arteries and all to see if there was any plaque built up, soft or hard. And if you're clean there, then that's good news.
It's exactly right. And I talk about soft plaque and hard plaque. There's a difference in terms of, what's more dangerous because you don't want plaque to break off because then it travels downstream and then it clogs your blood vessel. And part of this is, as we've always talked about, let's empower people with information. And the good news is with a lot of these new tests, procedures and lab tests, I'm going to give you your personalized data. So I'm going to tell you how much plaque you have in your blood vessels. I'm going to tell you what your 10-year risk is of having a heart attack. And a lot of times people will think, well, I'm feeling fine. I don't have any chest pain, so I don't need to worry about it. But I would argue you need to understand what your personalized risk is. And that's what's so important about giving people information that they can do something about. As you pointed out at the beginning, nothing's 100% preventable in life. But it's also not the other way, like, well, I'll just do whatever I want and I'll deal with the consequences later. Well, you might not be alive to deal with the consequences, or you may be impacted so much you quality of life is decreased significantly.
Yeah. And I think what some people don't think about is the fact that you might survive something, but how much damage has been done to the heart muscle, for example. If the heart muscle has been damaged, then the best you can do is what you're left with after the damage has been done. And if you can stop it before that damage has been done, then you got a whole lot better chance of having longevity and a quality of life. Stop it before damage happens. Because sometimes that's not all recoverable. Sometimes you can recover, but not always.
Yeah. And the longer you wait, the harder it is to recover. And just a fact for folks, heart failure is the number one reason why people over the age of 65 are admitted to the hospital.
Really?
And repeatedly admitted to the hospital. Even with all the medications we have, it is hard to treat. It is decreased quality of life. And again, it's not something that just happened all of a sudden. It's the behavior choices, including addressing stress and depression and all the other things that we're talking about for 10, 20 years. It adds up over time. And then it can get to a point where sometimes it is too late to make significant changes in the function of your heart.
Well, let's talk about the flip side, because we've said that you can have these emotions like anxiety, depression, stress that can really roll up on you and change your hormones, change the anatomy of the heart. And if the left ventricle is changed, that can recover, correct?
You can do things that can help it contract better. So there is some degree of recovery, yes.
Yeah.